Do you often find yourself going to bed feeling tired but wired, like your body's exhausted but your mind is going a million miles a minute and just won't shut up? If so, this video is for you because I'll be talking about some specific strategies that you can use to quiet your mind and actually get a good night's rest. Hi, if you're new here, my name is Parky. I'm a postdoctoral fellow in clinical psychology at Stanford's Sleep Health and Insomnia program. I also happen to have written a book on treatments of insomnia. It's called The Insomnia Paradox. Ostensibly, I know at least a couple things to be able to teach you today. So when I'm working with patients, I really want to be thoughtful as to what is the thing that is maintaining their problem. Even for something like quieting a person's mind, it's not a one-size-fits-all as to what strategy is going to be most helpful for them. And one of the ways I decide how to choose is actually based off the content of their thoughts. And there are four main different types of content that I'll talk about, as well as the main ways that we can deal with each specific thought. So before we even talk about the four evidence-based strategies, I do think it's important for us to really set ourselves up for success when we do go to bed so that sleep is most likely to take us away. And one principle we can really follow is to make sure that we're going to bed actually feeling sleepy, like we've had some time to wind down, to kind of ease into the bedtime. We have had some time to build up our appetite for sleep so that when we do go to bed, we're like, okay, my eyes are starting to droop. I'm starting to kind of do that head bobbing thing. So I know I'm ready for bed, because if we go to bed feeling wide awake, then it's very likely for our mind to take us everywhere because our body's just not ready for sleep. So therefore, what I encourage you to do is to make sure that the evening time is a protected time for rest. Maybe you can watch a rerun of Friends or do something that you enjoy. And then as you're kind of noticing the sleepiness cues come along, that is your cue to go to bed. Even if that's a little bit later than your usual bedtime. Let's say you usually go to bed around 11, but you're not sleepy that night until 11:30 or 12, then wait a little bit longer before you go to bed. Okay, so now let's talk a little bit about the different types of thought content, as well as the precise evidence-based strategy that you can use to target them. So the first one is simply worries. Worries can be largely broken down into either productive worries or hypothetical worries, where productive worries are the ones that need problem solving. Like for example, if you have an appointment tomorrow or some sort of task for work done tomorrow, those are going to be pretty productive worries. On the other hand, hypothetical worries are the things that don't really have an immediate solution. Maybe they're fears about the future or about a relationship problem you're dealing with that can't really be solved, or something else, whatever that might be. There's no imminent solution, so therefore there's nothing that can be solved, at least at the given time. So the specific evidence-based strategy that you can use, which we call in behavioral sleep medicine, is called worry time, where at its fundamental core, the idea behind worry time is that, hey, we shouldn't be worrying about all these things during the nighttime when you're supposed to be sleeping. So let's move the worries a little bit earlier in the evening so that you have a circumscribed specific period of time where you can do all that worrying, so that by the time night hits, you're already done with all the worrying, so you don't have to think about it anymore. And the idea is to take some time between 7 or 8 p.m. where you say to yourself, okay, for the next 5 or 10 or 15 minutes, my role right now, my job right now is simply to worry. So I can get a piece of paper or a Google Doc, whatever you want, and spend that time writing down the worries that you think will keep you up at night. For more productive worries, you can kind of write down the problem as well as the solution. Like, okay, I have an appointment I need to make, so I'm going to have to call such and such person tomorrow. However, for more hypothetical worries, what you can do is simply allow yourself to process. So you can just write your thoughts and feelings down in a stream of consciousness way, and don't worry about solving the problem, but it's a really nice way to expose yourself and process the stuff that's been coming up for you. So to get maximal benefits from the worry time, I encourage you to do it at least a few times over the next week. And then once you do it, to maybe take that piece of paper or take that document and put it next to you on the bedside, so that when your mind starts going crazy, you can kind of say, oh wait, like I've already done all that worrying. So maybe mind, you can go quiet yourself so I can get to bed. So besides specific life worries, another type of thought content is the everything, everywhere, all at once type thoughts, where essentially your mind is simply going a million miles a minute. It's the director of you. So it basically kind of goes wherever it wants, and you're pulled every which way when it comes to your thoughts. So it's very hard to really identify a specific thought pattern. You're just kind of going crazy. So when patients tell me that this is their specific thought content, specific being that it's literally everything, everywhere, all at once, one strategy I often find helpful to get them to do is to become the director of their own thoughts. So instead of having the thoughts direct them and pull them every which way, you become the director of the thoughts. So then you control the narrative and focus on something that you know can keep sustained attention. So what keeps a person's attention is going to differ from person to person. Some of my patients have had a lot of success from thinking about different endings to a recent movie that they watched, going on their own sort of dreamland adventure, being a pirate, for example, or counting down from 1,000 by 7 7, whatever kind of feels right for you is the thing that you should choose. So I encourage you to pick something that you know really keeps your attention, whether it's like a hobby, like thinking about riding a horse or playing the piano or cooking or coming up with a recipe, whatever that might be. Allow yourself to be the director of your own thoughts. So when it comes to directing your own thoughts, there's two really important things to consider. The first thing is that you want to practice this early in the night, not before your mind has already gone crazy and the monster has gone really big, because it's hard to kill a monster when it's super powerful and strong and huge. Instead, you want to kill the monster when it's small by practicing this directing your own thoughts earlier in the night. And the second thing that's going to be really important is to make sure that you're not doing this for the intention of falling asleep. The goal is to make sure that you are your director of thoughts rather than like your thoughts directing you. And it's best to kind of really practice this in the mindset of I'm getting better and better at honing and focusing my attention rather than I'm forcing myself to try to sleep using this activity, because the more we try to force sleep to happen, the further away sleep tends to get. So a third type of thought content are more specific to like existentially related concerns, like thoughts about death or the meaning of life. These types of thoughts are kind of harder to process, and they're not really solvable, and they're not really necessarily something that can be easily directed away from. So one strategy I often find helpful is the use of mindfulness practice, the practice of letting go, the practice of noticing that these thoughts are happening and seeing if we can kind of visualize their disappearance or just observing them rather than giving them too much power. Because ultimately, although these thoughts are really powerful questions, they don't necessarily need an answer, and we don't necessarily need to engage with them. So see if you can kind of just noticing them and then allow them to pass away. And with both directing your thoughts and mindfulness, I think of these practices like building a muscle. It takes a lot of repetitions to get really good at them. So I wouldn't assume immediately that just because you couldn't let a thought go, that mindfulness doesn't work for you. Just continue that practice. Continue noticing, letting go, noticing, letting go. And every time that you notice that you're having these thoughts and you're able to try and let them go, that is mindfulness and you're doing a great job. So the fourth and final type of thought content are more specific to people with significant sleep difficulties or with insomnia, because there's specific anxious thought about sleep itself. So for example, if I don't get enough sleep, tomorrow is going to be horrible. I'm not going to be able to sleep well tonight. My health is going to be really problematic. All of these things, of course, counterproductively make it hard for us to be able to sleep well. And the strategy that I use, which I call the REST framework, stands for resilience, education, sleep effort, and thought challenging. And I'll go through each of those strategies in turn. So the R stands for resilience. And one of the things that can be really helpful for people with insomnia to know is just to remind themselves of how resilient they've been in spite of their sleep difficulties, how successful they've been in their job, in their day-to-day, in taking care of their family. Yes, things have been a lot harder, but you've been able to get through the most important parts done. And by reminding yourself of that, that at least attenuates the anxiety a little bit to potentially get a good night's rest afterwards. So after resilience, the E stands for education. And one of the things that can be really helpful, at least I found with patients, is that simply by educating them on certain topics, it can actually reduce some amount of anxiety. So for example, one common myth I often hear is the 8-hour myth, that if I don't get 8 hours, I'm going to have significant mental issues, medical issues, all of these problems that come from it. But one of the things that's helpful to know is that everybody's sleep need is going to be a little bit different. Some of us need 8 hours, some need more, some need less. And it doesn't necessarily mean that if you're not getting 8 hours, all of these horrible things are going to happen to you. Other things that can be helpful to know is that the subjective objective differences in performance is actually larger than what people think. So people with insomnia think I'm doing horribly, and they think they're so tired that they can't get anything done. But a lot of research seems to suggest that there's not as big of a difference between these objective parameters as people with insomnia might think, that even if they feel like a lot of things are harder, their performance, at least for the things like in daily life, things to get by in day to day, are actually pretty darn good. It's harder, it feels harder, but it's pretty good nonetheless. And the S stands for sleep effort. And I've talked about this idea a little bit earlier, where the more we force sleep to happen, the further away sleep gets. And the way I really illustrate this point is with the finger trap, where essentially when you try to pull yourself out of it, you get stuck even further. And it's actually by kind of like accepting and pushing your fingers together where the finger trap then allows you to kind of escape. And just the same with insomnia, if we try to force sleep to happen, we resist being awake, it makes it even harder for sleep to come take us away. But if we can kind of relax into wakefulness and say, hey, you know what? It's okay for me to be awake right now. I don't really mind it. That actually reduces the sleep pressure of the sense of like needing to sleep, and then allows you to be more likely for sleep to be taking you away. And finally, the T in the REST framework stands for thought challenging, where basically you're testing the validity of a thought, where you can do this already through some of the resilience pieces or the education pieces, where you're essentially targeting the validity of a thought by identifying whether or not that thought is actually true. Like the thought, if I don't sleep well, I'm not going to be able to function tomorrow. Well, one thing that you can kind of say is, well, have there been nights where I had a terrible night, but then the next day I kind of got the most important things done, or I had a presentation I was super worried about. I thought I was going to do horribly, but then once I kind of did it, people were like, hey, you did a pretty good job. So that can be one way that you can test sort of the validity of the thought and do some thought challenging. But you can also pick any of the ones from the REST framework to be able to deal with your sleep anxiety thoughts and then focus on the most important ones that work for you. And remember, we want to be wise therapists and pick the right precise tools that work for you. So we don't want to throw the kitchen sink and see what sticks. We want to pick the ones that actually feel right given what struggles you're experiencing in the nighttime. So I encourage you to pick one or two that seems like a good fit for you. Give it a real good shot and we'll see what happens. Anyway, that's all for this video. Subscribe if you haven't already. Thanks for watching, and I'm wishing you some more restful nights down the road. Take care.